So what are the options for people that are either have been told can't save their teeth, they need dentures,
Okay.
or those people that are currently wearing dentures? What are the options when it comes to dental implants?
Yeah, okay, so there's a few options. Number one, like on the lower, you can have 2 implants, a full set of teeth that snaps in and snaps out, which is great. It's way better than a denture, but the problem is that it rocks a little bit, and they have to come see me like every few months to have those little attachments changed.
All right.
Because when you take them in and out, they get loose. The next option is you can place a few more implants, also have something that snaps in. It's not going to rock as much, but you still have that maintenance. So you're still going to have to come see me all the time.
So they get a full set of teeth that just lock in.
A full set of teeth that snap in and snap out, okay? But there is that maintenance. The third option is really what everybody wants. A few implants, 4 to 6 implants, and something that's fixed. It doesn't come in, it doesn't come out. A full set of teeth, we can actually cut out the palate on this. So denture
for
wearers,
the upper.
Yeah, so for the upper, denture wearers, they have a hard time tasting their food because there's actually taste buds on the roof of your mouth. So when you cut that out, it's like a new experience for them.
Really?
Yeah, they can taste everything. It's like a whole new thing.
How soon could they eat after it's done?
Same day.
Now you teach this.
Yeah. So
at
I teach
USC,
this.
and you've trained all over the world.
Yeah.
Tell me about your training when it comes to dental implants.
So I actually did a dental implant residency in Brazil, which doesn't actually exist in the United States. So there isn't an implant specialty in the United States, but in Brazil there is.
Okay.
So I did a full year of training where all I did was implants.
You went to Brazil for a year?
Yeah, I had to learn Portuguese and move to Brazil.
Okay.
Just to learn dental implants.
And then you also teach it at USC?
I teach at USC, and then I travel around the world teaching other dentists how to do implants.
But you're big on this, giving them teeth that don't come in and out.
Right, that's what everybody wants.
Like none of the snap in, snap out dentures.
Yeah, some patients like the snap in and snap out because they can clean it, but 95% of my patients, they want something that psychologically doesn't feel like a denture. They want something that they can eat, chew, whatever they want. They could smile, they can blow their candles out at their birthday party. They can, be confident with their smile.
Do they look real?
Oh my gosh, you wouldn't know. You wouldn't know any of our patients that have had dental implants. The laboratory technicians that we use, we work very closely with them, and I design it. Okay. So me and my partners get together, and we design how it matches the lower lip, how the colors change, how the gums look, so no one would ever know. And it's a full set of teeth. Okay, so it's like a horseshoe of teeth that they can chew whatever they want, and it feels like natural teeth.
How old could you be to do it?
Okay, in my residency, I worked on a patient that was 96 years old.
Wow.
Okay.
Why would they want to do it at that age?
Because it's a quality of life issue. It's not just about teeth and gums. It's about eating. It's about smiling. It's about kissing. It's about intimacy.
Okay.
A lot of people are dating into their 70s, 80s, 90s, and they're nervous about their partner knowing that they have a denture. So they want something that's fixed, that's not going to come in and out.
And maintenance, they just get them cleaned like regular teeth?
Just like regular teeth. They come see us, we clean the implants, sometimes we take them out and clean them, put them back in. It's amazing.
And you're doing everything guided.
Yeah. So
and you say it's not always done that way.
No. Really rarely it's done with guided surgery.
Guided on a computer?
Yeah,
so how does it work?
I have a software system, and I help develop the software system. And we plan the surgery. We actually do the surgery in 3 dimensions on the software. So let's say you come in, you need some implants. I will do your surgery 2 to 3 times on my software, and then I'll 3D print a guide. We put that in your mouth, and we place the implants through the guide, so they're placed in perfect precision. This is the safest, most predictable way of doing dental implants.
Is that why it's been able to do it so quickly?
Yeah, so we can do it faster, meaning that there's less pain, less swelling. Most of my patients take an ibuprofen or 2 for a day or 2, and that's it.
So no more dentures?
No more dentures.
Do you think that's a future?
Not in my practice.
Do you think that's the future of dentistry, where someday there just won't be a traditional denture? They'll all be locked in?
For sure, yeah. I mean, even now, patients that come into our practice that have dentures, they don't have dentures for very long. Everything's attached to something, and they can eat and chew whatever they want.
Now, for the crowd, we talked about this at the very beginning, that they have like the bleeding gums and the really bad gums.
Yeah.
Are they candidates or no?
Yes, actually. A lot of people think that if you have bad gums, that means you can't have dental implants. And that's a fallacy. So what it is a lot of the problems are based on the teeth. So everyone's worried about pain. Okay, that's why a lot of people don't go to the dentist. And that should be a thing of the past now, because we do sedation. Okay. So I can actually put the patient to sleep for the procedure. They wake up and it's done. They don't remember anything. And the other thing is with dental implants, there's not a lot of pain.
Why is that?
It sounds weird, right?
Yeah.
Yeah. People think that you're going to put an implant into the jawbone, you're going to have pain, but the bone doesn't have pain fibers. So any pain just comes from the gums. Most of my patients, like I said, take an Advil, ibuprofen, and that's it.
Now we should mention, at your center, I guess how it's normally done is you go to one doctor that does the surgery, and then another dentist that puts the teeth on top, and somewhere else for the imaging, and you do it all right there.
Yes.
So aside from convenience, what's the advantage?
But convenience is a big thing. Everybody's busy nowadays.
Okay.
So if you can do everything in one place, that makes it very easy. The second thing is communication. Communicating between different specialists and lab technicians and imaging centers can be difficult. So how we do it all in the same office, our communication is really seamless. And then the last thing is we can actually pass on the savings to the patient. So we can actually save them some money by doing everything in one place.
So you do the surgical part, Dr. Nejad, and you say he's like one of the best cosmetic guys in the country.
Yeah, for sure. Dr. Nejad is amazing. He teaches people from all around the world how to do cosmetic dentistry.
Thanks again.
Thanks a lot, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.